Hey there, my name is Haley and I am a disabled yoga teacher. For the past 6 weeks, I have had the pleasure of living with bilateral nephrostomy, pigtail nephrostomy tubes, in other words, kidney tubes. Since I have 2 kidneys, I have 1 bag for each kidney. And then in addition to that, I already had a bladder bag. I have a suprapubic catheter, so my tube goes through a hole in my belly, lower belly, to drain my bladder that is going to be removed. Basically, I'm gonna have these for a few months. Hopefully not more than 1 or 2. But basically they're protecting my kidneys from hydronephrosis and just damage and whatever from having end-stage bladder, which will be removed soon and replaced with a stoma. When I was waiting to have a simple cystectomy with Ileal Conduit urostomy surgery, I was desperate to find any information I could about what it would be like. I couldn't find anything from a patient's perspective on YouTube. The only content I could find was from patients with ostomies, but that wasn't really comforting as it's a totally different surgery. Sure, there's some overlap with ostomies and urostomies, but like bag changes and supplies, but I wanted more. So this video is for anyone curious about simple cystectomy and ileal conduit urostomy surgery and recovery. We are on our way to Palo Alto for our pre-op and stoma nurse appointment. Woohoo! Mom is sick, so we have to mask. Yay! At the stoma nurse pre-op visit, the nurse marked a spot she thought would be best for my stoma to go and took a bunch of photos. After the visit, I couldn't wait to have surgery. Each day felt like an eternity because I was in so much pain despite high doses of opiate pain medication. We just checked in at the JW house. We have this huge kitchen living room area, and then there's another room with 2 beds, but I claimed this window bed because it's so freaking cute. Oh my god, and there's a therapy dog coming at 5:30. But what I'm most excited about is my power chair is getting delivered here any minute. I'm so freaking stoked. We were warned that the surgery recovery would be long and hard. Already struggling to use my manual wheelchair, it was a huge relief to receive my power wheelchair the day before surgery, since we knew my mobility would take a big hit post-op. Even though I had weeks to try on an ostomy bag, I didn't try it on until the night before surgery. I'm not sure why it took me so long, even though I was truly looking forward to not being tortured by my bladder anymore. For some reason, the night before big surgeries, I feel oddly calm, even though I should be panicking. I pulled an all-nighter since I had to clean out my colon. The combo of severe diarrhea and not trying to sleep helped me because I was too tired to panic. Although I did get pretty stressed out when my accessible ride to the hospital was a half an hour late and then called me to get directions because he couldn't find where I was staying. It was a bit stressful. One other thing that helped me with my anxiety heading into this huge surgery was just practicing gratitude. Firstly for the JW house for letting my mom and I stay there before the surgery, and then my mom staying there for the day or 2 after my surgery. For the JW house, but also for Access Medical for getting my powered chair to me just in time. When I arrived in the PACU, the nurses were extremely kind and helpful. One promised me she'd personally escort my power chair to me once I was out of surgery, and she placed a name band with my info on it on the backrest just in case. I saw my surgeon and couldn't thank her without crying. Then the anesthesiologist popped in and asked if I could sit up supported for the epidural, which fully triggered my medical PTSD and I just started sobbing. I kept apologizing, but everyone was so supportive and didn't make me feel like I was overreacting. They gave me something in my IV for anxiety as I curled up in a ball on my side, as he felt it would be best for me to be lying down. My memory ended right there. I got myself so worked up to have the epidural, and I can't even remember any of it. I also don't remember being taken into the OR. first day of my surgery. Every time the epidural wore off, I was screaming in pain. So they've made like several adjustments to my epidural because I'm burning through the numbing medication way too fast. So now it's day 1 post-op, and at least I'm more numb than I was yesterday. I was so happy though to wake up from surgery and not be able to feel my urethra, not be able to feel my bladder. Like, I was so relieved, I was crying. Up until I coughed for the first time, and then I was screaming in pain again. It only gets better from here, right? The incision goes all the way up to like here underneath this, and there's a drain but no like staples or stitches. And there's my little ostomy. And this is my it's fentanyl and dilaudid that's in my epidural. This goes into my epidural, or controls the meds. And they've been draining this like several times a day. Even though we had such a hard time managing my pain effectively with the epidural, I just remember being so relieved. It was comforting knowing that my pain would only improve each day. Having waited years for relief, I was so grateful that the surgery went well. My mom came to visit me and celebrate my birthday. It felt like a rebirth. I was starting my new life without bladder issues and tubes. Well, actually, I was extremely disappointed that I woke up with the kidney tubes still there, but I was promised that they would be removed in a few days, so yeah. I was kind of freaked out when they removed the epidural, but it turns out that it didn't even hurt. So yeah, not sure the epidural was even doing anything, really. My first ever bag change, I had an amazing nurse. I still had a lot of anxiety. I was worried that it was going to be painful, and whenever the pee would like leak down my side, I felt like the nurse wasn't being fast enough. I was so nauseous, I could barely even look at it. Like, I took one look at it and like saw it move, and I thought I was going to faint or throw up, and I even told my nurse that I was going to. And she was like, don't worry about it. So she did the entire thing. And I guess it wasn't as bad as I anticipated.
I was not responding to everyone yesterday because I was busy throwing up a lot. They did an x-ray, and I guess I have ileus, which is a common post-op condition where you throw up everything in your stomach and in your small bowel. And yeah. Has not been a good time. And throwing up when you have abdominal stitches, terrible. But I did want to say that I got my own private room, so that's super exciting.
Since I couldn't stop vomiting, nurses came in and placed a tube up my nose to decompress my bowels. Having this tube placed was the second most traumatizing experience I've ever had, second only to waking up intubated after I coded at age 18. I can now say with full confidence that I would rather be paced by a defibrillator than ever go through that again. Once I had my tube placed, it took a long time for me to stop gagging. The tube stopped the vomiting, but my nausea was still severe. They had me on so much anti-nausea medication that they had to monitor my heart. I didn't know how long I'd need the tube for, and each moment was torture. At one point, I had drifted off to sleep, and in my dream, I began pulling out the tube. Luckily, the tube coming slightly out woke me up, and I immediately froze with my hand around the tube. Too terrified to have my nurses want to replace it, I took a deep breath and pushed it back in where the permanent marker dot was. For me, the next few days took me to rock bottom. They started me on TPN via my central line, which is basically IV nutrition, so that my body would have the nutrition it needed to heal.
I was terrified. TPN can cause blood infections, and I was worried that my bowels wouldn't wake back up and I'd be stuck on TPN forever. Talking and swallowing was miserable. Just when I thought things couldn't get any worse, my tube stopped suctioning. I was told we had no choice but to take the tube out and replace it with an even larger one. I genuinely didn't care if I died. In fact, I begged the universe to just take me. I had the tube for a total of 5 days, and looking back, I'm honestly not sure how I got through it, but if anything got me through, it was definitely my nurses at Stanford. The staffing ratio there is a lot better than the local hospitals that I'm used to, and they were just very responsive and did everything they could to make me as comfortable as possible and to distract me. I don't want anyone to watch this and decide not to have the surgery if they need it. I want to be honest about how difficult the recovery was, but I also don't want to scare anyone away. I also want medical professionals who may be watching this to understand the patient's perspective of this brutal recovery so they can better support them. At the time of editing this vlog, I am 3 months post-op and my life is so much better because of this surgery. I wish I could hug every single person who was involved in my surgery and aftercare. And I'm also incredibly thankful for the village of support that I had on Instagram and through friends.
Hi, I put face lotion on today. This hose probably isn't coming out today, but they're hoping to take my kidney tubes out today. So yeah, hopefully all of my kidney stones can come out. Miss you.
My second bag change, I still felt like lightheaded looking at my stoma, but this time I at least managed to pay attention to what the nurse was doing. I felt motivated to start learning about how to take care of it since I knew I wouldn't be in the hospital forever. But yeah, it looked way less gnarly this time. Also, the stoma nurse brought me a huge gift baggie full of stoma supplies. I ain't got nothing in my nose hose. And I got 30 ice chips. Mom and Edgar here. Best day ever.
3:10 in the afternoon.
Only the hospital AC is broken, so that's not really cool.
A little warm, but yeah. At least the nose hose is out.
Now that the NG tube was out, I didn't really have much to complain about, and my mood and optimism got a lot better. I was able to enjoy my day again rather than spend every waking moment in being tortured. So yeah, was motivated to move around a little bit, and the nurses were able to use a Hoyer lift to get me into my power chair. It felt so good just to have one full day where I was mostly left alone. The morning of day 12 into my recovery, I had my stents removed out of my urostomy. I was promised that it wouldn't hurt and I wouldn't really feel it, so I didn't need any sort of medication to get me through it. And yeah, I sobbed for a while. It was extremely painful for a hot minute. So I rested a bit and then was determined not to let it ruin my whole day. Got back in my chair. And it's my second time emptying my urostomy bag by myself. I'm using the seat elevator so that you can see. I tried like rolling up to the toilet, but the toilet's way too far away from like my bag, so let me see. So because the stents being pulled for my stoma was so yuck, I was pretty anxious when the doctor suddenly walked in to remove my kidney tubes. Having them placed is so traumatic that I definitely expected their removal to be horrible. Luckily, he was so fast I didn't even have too much time to flip out, and I was in shock because I barely even felt them come out. The worst tube to come out was definitely the drain I had on the other side of my belly.
My pain pump wore off and I was in 10 out of 10 pain. So they just gave me 40 of Oxy and Valium. And it took the edge off. So I'm chilling waiting for the fireworks to start. Check it out. My nurse rotated my bed so I can have a better view. That's the East Bay, so I'll be able to see all the fireworks.
It felt surreal because once all my drain tubes were out, I got to watch the fireworks, and I remember thinking to myself, I'm finally free. It sort of felt like the fireworks were just for me, signifying my victory and the end of this shitty chapter. That night, my pain had intensified quite a bit, but I assumed it was because I was transitioning off of the pain pump, so I didn't really think anything of it.
The stoma bag wasn't draining into the night bag. And now it's leaking. It's so sad.
Going into this surgery, I knew that eventually I would have a bag leak, and I was really impressed with myself that I didn't have a mental breakdown when my first bag leak happened. Even though I didn't want to, I forced myself to participate a lot in this bag change because I knew that I'd be going home soon, so I really needed to learn how to manage it on my own, or I would be going home with a ton of anxiety. So I was really proud of myself for doing most of the work for this bag change. My nurse placed a second ostomy bag over the drain hole because it was weeping quite a bit of fluid, and they told me I could take it off when it stopped draining, basically. Because my pain was so much better and I was managing my ostomy mostly on my own, doctors wanted to send me home, but since I was still having significant pain after eating, like in my stomach, I asked to stay one more night. I spent another night writhing in pain from my stomach, and I brought this concern up to the doctors, and they told me it was just gas and said that I could use Gas X to help with the pain. By then, I was completely off of TPN, and I was reassured that I was good to go home, but that they would keep me one extra night just for my peace of mind. I was anxious to leave the hospital and to be completely responsible for caring for my ostomy, so I made a little emergency kit. This helped me to feel ready to leave, and I was picked up by a non-emergency ambulance to be taken home. Being in a bumpy ambulance made my pain explode. 2 hours into the drive, I asked if they could take me back to Stanford's emergency room. It was hard to breathe. We had two options, go home or call 911 and go to the nearest ER. I chose to tough it out, hoping I'd get better once home. I was so happy to be home, but I spent another night in agony. Having a few bowel movements didn't help, so the next day we called 911. On IV antibiotics
for absolutely nothing that has to do with my surgery, because my body has decided to personally victimize me and give me acute pancreatitis on top of recovering from major surgery. It's just great. I think that I got it from TPN because the symptoms started like when they transitioned me from TPN to food. So, not really too thrilled with Stanford sending me home like that. Yeah. Also, I am so freaking spoiled by Stanford nurses ratio. You hit the call light, Stanford nurses will come running in, like, pretty much immediately. I wish I was home so bad, like being home for one day. I'm so fucking sick of being in the hospital. I did not sign up for this. I had to do my first ever bag change by myself, so I called my mom since my nurse was nowhere to be found, and she helped me. And then I called my uncle to come be with me because of ileus. I needed another NG tube. This time I didn't tolerate the NG tube well at all. I couldn't stop gagging for what felt like hours, so they finally had to drug me so that I could relax. And they put me on TPN. I'm finally in a room. I'm on TPN. My hemoglobin came back up to 8.4, so no need for a blood transfusion, but they're gonna keep an eye on it. Hi, Mom. I have a small bowel obstruction and pancreatitis, so probably gonna be on TPN for, I think she said 10 days. I hope that this tube doesn't stay up my nose for 10 days. Anywho, definitely missing Rolette's experience, but I hope you all who get to go have an amazing time and have lots of fun for me. I'll be watching everyone's Instagrams. My pathology report came back from my bladder surgery, and they found CD117, an immunological marker for mast cell. So I have proof that mast cell destroyed my bladder. Also, there was something else, but I forgot. Yeah, I can't remember. I had to be drugged the entire time I had that tube in, and I ended up pulling it out without my nurse, and I was extremely lucky that they didn't have to put it back. I was able to not vomit with it out, and they really wanted to put it back, but I told them absolutely not, and I was lucky that they didn't push. I was still on TPN for a long time, but at least no tube. Good morning! I was so excited because my earrings that I ordered from this local crafty artiste finally arrived. I had them sent to a wrong address, so it took forever for the post office to forward them to me. But I think they're so cute because it is way too hot to wear like head coverings in the summer. So I was like, you know what? I'll just wear gigantic earrings and that'll be my summer personality when I don't feel like wearing a wig. Still on liquid sunshine, but feeling a lot better every day. So hopefully I won't be in here for too much longer or on TPN for that much longer.
Little did I know I would be spending the entire month of July inside of the hospital on TPN, not seeing the outside. My heart, which was previously completely stable, started going into a junctional rhythm, which is an arrhythmia, and that was pretty terrifying. Doctors were telling me that I would probably need to start being externally paced, and then I would need pacemaker surgery. So I was freaking out for several days, worried about my heart, worried about my heart surgery, and later on, when my surgeon pulled my loop recorder or internal heart monitor implant data, we saw that my heart had paused for 3 entire seconds. So that was kind of scary, given my history with respiratory arrest and neurocardiogenic seizures.
Today's dinner, lipids and TPN. But we're starting to wean it a little bit because I was able to eat 2 yogurts today. So if my lipase is good in the morning, then it's like a green light to start progressing my diet. Look at this freaking mess. My God.
Also, I have really good news. So I saw an electrophysiologist today, and he was able to tell me that my sinus atrial node is not malfunctioning. So that's really reassuring, because I was really worried that my heart surgeries may have injured my sinus atrial node. But no, my heart rate is going severely bradycardic, so we've been talking about a pacemaker. But turns out that I am just vageling myself. With dysautonomia and autonomic dysreflexia, like, my GI issues are triggering my vagus node, my vagus nerve, to make my heart rate drop. So I do not need a pacemaker. I cannot die from this arrhythmia. It sucks. It's so uncomfortable. But I am so relieved that I don't need a pacemaker. I also was just really pleasantly surprised that this electrophysiology knew so much about dysautonomia, and he was like, yeah, it's just your dysautonomia. Like, he was like, once your GI issues calm down and you heal from this surgery, I think things will go back to normal. So yeah, I'm still waiting to hear from my heart surgeons, because I really want to hear their opinion on all this too. So waiting for them to get my loop recorder data, look at everything, and also reassure me that I'm okay, because it is really uncomfortable feeling, and it's making me really exhausted and weak having my heart rate drop into the 30s. So I'm really hoping that it's super temporary and then it goes away once my GI stuff is better. But yeah, just feeling more optimistic overall about. I have a 3-day gap in vlogging because on July 24th I developed a 103-degree fever and was projectile vomiting. It sucked because I was finally making progress with my oral intake. I couldn't even keep down 2 sips of water. I was terrified I had gotten a blood infection from the TPN. I was placed on broad-spectrum IV antibiotics right away.
The doctor I had for the first part of this hospital stay had an amazing bedside manner. Every time he had checked on me, he told me to take as much time as I needed to rest and heal because I had so much going on. Unfortunately for me, he eventually went home to get some rest himself. The doctor who replaced him was the complete opposite. Days later, she came by to let me know that I had a kidney infection. Several days prior, I had sudden severe kidney pain that came and went. So at 3 a.m., I had to chug contrast for a CT scan, but I vomited the contrast, so they let me skip finishing it. The CT scan showed hydronephrosis and a kidney infection. She questioned why I was still vomiting and why I wasn't eating, why I wasn't better yet. She made me get a psych eval because she accused me of taking too long to recover and insinuated that all my medical trauma was stopping me from getting better. I countered, "Don't pancreatitis and a kidney infection cause vomiting?" She said no, they don't. I silently questioned where she went to medical school. I was so angry that I was so sick, and I got a doctor who was such an ignorant idiot. I mean, I was having heart arrhythmias, my hemoglobin was low enough to warrant a blood transfusion, I had pancreatitis and ileus. Like, I was a mess. Also, I had an episode where all the muscles in my body locked up, contorting, and I couldn't get them to relax. It was excruciatingly painful and scary. My potassium was super low again. The entire stay, they had been giving me potassium and magnesium via TPN and separate infusions. The nurse and doctor didn't seem to care how much pain I was in. They had a very dismissive attitude. I screamed at the doctor and nurses to help me, and they had my nurse infuse potassium immediately, which helped. I hadn't had an episode like that since I was in high school. The nurse scolded me that if I screamed like that again, they'd kick me out of the hospital because I was disturbing the other sicker patients. It was a really low point for me. It'll be better looking by the video. It's pretty look for the nurse. Maybe we'll wait. I'm gonna come.
I don't think you have enough wires. I don't know why, but the Castaway song from Little Einsteins just came to my mind. I thought you were going the other way.
I was gonna say
Experience a new hallway.
it's very long. It's a very long hallway. I don't want to commit.
Look at this progress this girl's making each day. Like, what?
Go the long way.
What?
Do you want to go with me?
What?
Down the other hallway?
Sure. I could do one lap.
Okay, let's do one lap. You just told me not to go. I was trying not to lose somewhere.
Does that need to be in front of you?
This one.
Should I push that for you, or?
Oh, hi again. Oh, hello. They told me to get out of bed today. This is me getting out of bed.
That is brilliant.
Yeah. Yeah.
Hey, you should have done that the first time. Look at that. Look at that. Look at those skills. Now she can use. Now she can use two hands.
I've become a infusion pump technician. You guys, Coloplast sent me the nicest, like, welcome kit. They sent me sample bags to try, which I'm super excited about because I don't like the color bag that I have right now. So this one will be a nicer color. Weirdly, the stoma part's see-through. I don't know if they have bags that aren't. I don't know. And then they sent me the wipes because I really wanted the wipes. But check out this really cool little toiletry thing they sent me. Isn't this awesome? And when I can go home, I'll be able to eat again, and my medications are gonna decrease, like the number or amount that I was on before my surgery, so a lot of the side effects that they cause are also gonna drop off. So I'm just trying to reframe my headspace to be more positive. Yeah. And manifesting a healthier future for myself, hopefully. Also, my fevers are finally going away. We don't know if it was a kidney infection or if TPN gave me a blood infection. Still waiting on blood cultures to come back. But yeah, might be done with IV antibiotics soon. But just wanted to share my thoughts. This community is really beautiful in that we can watch each other walk through our journeys health-wise and all of our setbacks and whatnot. So I just wanted to share my experience on TPN because I never thought I would end up on it. It was always like a fear of mine, but I never thought it would happen to me. So just wanted to share my experience. To those of you on TPN, you're freaking like, it is scary, but yeah, hopefully temporary. Since I did just have bowel surgery, I gotta say, I was having diarrhea once every day. Whenever my bowels would move, I felt painful cramping. Prior to the surgery, I needed a super aggressive bowel program. Now, I didn't need anything to go. Not sure if that was due to the TPN or just my bowels coming back after being paralyzed post-op. This entire hospital stay, exhaustion was my main nemesis. It took everything I had to shower, but unlike before my urostomy surgery where I could only shower once a month, I was now showering at least once every 3 days. It felt so good to shower regularly. I shaved my head because only showering once a month I always felt disgusting with greasy hair. Now that I could shower regularly again, I could start to grow out my hair. Just pushing myself in my wheelchair or sitting upright was extremely difficult for me, but I knew it was important, so I forced myself. One lap around the hospital floor felt like walking a half marathon, and sitting up for me was as exhausting as holding a plank.
Oh yeah, baby Yoda.
Where's Mom? You wanna know what's kind of annoying? I put on a new bag today, Hollister brand, and then I realized that I didn't have a connector to connect my bag to a Foley catheter bag. So the hospital doesn't have it,
So I'm gonna have to wait till Mom can bring me one of the ones I have at home tomorrow. So every 30 minutes I have to wake up to empty my bag. And me being me, I can't stop drinking water because I'm so freaking thirsty all the time. So that's not helping. I drank an entire boba and then a Sprite and then a Gatorade. Why am I so dumb? Edgar brought me the connector. Yay! Also my lipase went up after eating food yesterday. So I'm back on a liquid diet, but at least I'm not back on TPN. So we're making progress still, even though I'm on a liquid diet again, because I'm not on TPN anymore. So.
I missed my power chair so freaking much when I was gone. Oh my god. I missed it so bad. Hi, Bella. Bella can't see, so I have to be really careful when I'm moving around in my power chair because she can't see and she is pretty clueless to my power chair's existence, so I have to be really careful. Once I got home, I was finally able to sleep, and I was so happy to start dressing up and going places. I'll be posting more post-op milestone updates, so look out for more. Thanks for watching!